Today we're providing an overview for osteoporosis. What is osteoporosis? Bone normally consists of two key components, one called hydroxyapatite and the other osteoid. In osteoporosis, there is a reduction of both of these components of bone. Sometimes the terms osteoporosis and osteoarthritis get confused. Are these the same thing? Well, while they sound similar, they are in fact very different. Osteoarthritis, which you can review in other videos or on our website, is a problem with joints which can cause pain and functional disability. Whereas osteoporosis is thinning of the bone. With osteoporosis, unless you break a bone, it does not directly cause pain or disability. Why does osteoporosis happen? Well, bone formation is regulated by two types of cells. One causes bone to form, called osteoblasts, and one causes bone to break down, called osteoclasts. In normal, healthy bone, these cells work together. They slowly break down older bone and replace it with newer bone over long periods of time. But in osteoporosis, bone breakdown occurs faster than bone formation. This reduces the overall bone mass. Why is this even a problem? Why is it a problem to have thinner bones? Well, patients with thinner bones with osteoporosis have an increased risk for breaking their bones, and these fractures can happen with minimal trauma. The most common fractures that we see in osteoporosis are fractures of the hip, the vertebrae, the bones in the back, as well as the wrist. Osteoporosis is a common problem. Some studies estimate 50% of people over the age of 55 may have osteoporosis, with many more at risk for developing osteoporosis, the majority of whom are women. There are risk factors that can increase your chance of having osteoporosis. Some of these we cannot control. Things like increasing age, female gender, early menopause, a family history of an osteoporotic fracture, a previous fracture thought to be due to osteoporosis, as well as certain diseases, including, but not just limited to, things like rheumatoid arthritis, common in rheumatology, hyperparathyroidism, hyperthyroidism, and more. There are other risk factors which we can control, and these include smoking, alcohol use, caffeine intake, low weight, poor calcium intake, as well as the use of certain medications, and particularly in rheumatology, glucocorticoids, or steroids or prednisone would be the most common. How do you know if you have osteoporosis? Well, most people who have it do not know it unless they get tested. Because unless you have had a fracture, it does not cause pain, it does not cause symptoms. Some people with osteoporosis may notice loss of weight or more of a stoop in their back, which can be due to undiagnosed vertebral fractures. How do you test for osteoporosis? It's best tested using a machine called a DEXA scan. This is a very low radiation safe test which measures the bone density of both the lower back and hip. If you are diagnosed with osteoporosis, what is the chance you'll break a bone? Well, the risk of fracture depends on many things, and your bone density is one, but only one, important component to determine your risk. It is also important to consider age, previous fractures, your other medical conditions and medications, your overall risk to determine if your risk of fracture is high or not. Your doctor, by having all this information, can use this all to best determine your fracture risk. Typically, this could be determined over a 10-year period by saying you have a low risk, which is less than 10% risk over the next 10 years, a medium risk, which is 10 to 20%, or a high risk, which is greater than 20%. Sometimes you may hear the term used osteopenia. Is this the same as osteoporosis? Osteopenia is a term that has been used for patients who demonstrate low bone mass on a DEXA scan, but not quite low enough to be called osteoporosis. For osteopenia, treatment may, but may not be recommended, depending on age and other risk factors you have for a fracture. How do you treat osteoporosis? Well, there are many medication options available, with a class of medications called bisphosphonates being the most common. And there's more information on this on our website as well. You should discuss always with your physician what medication treatment option is best for you. But there are also some very important steps you can take which are not prescribed by your physician. Things like changes to your diet, ensuring you have enough calcium intake, vitamin D intake, as well as regular weight-bearing exercise, things like going for a walk. Are there things we can do to reduce the chance of developing osteoporosis in the first place? Absolutely. And these things are those simple measures that you would also use to treat osteoporosis. Calcium intake remains important. Vitamin D intake remains important, as does regular weight-bearing exercise. It's also important to keep in mind that the ultimate goal of treating osteoporosis is not necessarily to make the bones strong again. So it's not necessarily that your DEXA scan will improve. The goal is to safely lower your risk of breaking a bone. For more information on osteoporosis, its treatment, or anything else related to rheumatology, please feel free to watch our other videos or visit our website at albertarheumatology.com.